Thank you for joining us. My name is Kelly Jenkins, and I'm a Business Development Manager with Delta Controls. We are very excited to be participating in BCCPA's first ever virtual conference. And we would like to give special thanks to Kathy and her entire team for their creativity and hard work making this conference a reality. The goal for our workshop is to introduce to you building automation technology solutions that will ensure safety and care of your indoor environment. Presenting with me today are industry leaders and innovators who are committed to developing technology solutions and processes for senior housing residents and healthcare staff. This workshop is pre-recorded. However, our team is on standby for live video chat, and we have reserved a few minutes after the presentation to take any live calls and answer questions that you may have. A little bit about us. Delta Controls is a global leader in building automation systems. For over 30 years, we have led the industry in innovation and sustainability. With over 400 distributors in over 80 countries, you will find Delta buildings in healthcare, hospitality, commercial, as well as educational markets around the world. As one of the Delta Group companies owned by Delta Electronics, we are committed to leading building automation into a sustainable future. Today, we will be presenting processes and technology solutions for COVID detection, prevention, and the benefits of building automation. You will be hearing from Jin Kim, who is our solutions architect, Dr. Dorota Balkovska-Wawasko, one of Delta's product solutions managers, and Jamie Feardon, a building automation specialist. Before I kick off our workshop, I want to share a reflection that I had while we were preparing for this presentation, which was pre-COVID, and it seemed like a lifetime ago. Building controls have evolved from energy efficiency to the occupant experience. The data available now from your control systems allow building owners to make decisions on how people are using the space. We have been able to connect different systems together, collect more data, and do more analytics to make buildings so much more intelligent. By implementing sensors and other connectivity, we can upgrade your environments in an affordable way. At the end of 2019 and early 2020, we began looking into some of the most difficult challenges that senior living facilities were facing and how building automation solutions could solve those challenges. According to Senior Housing News, the top challenges for 2020 were workforce shortage. With the lowest unemployment rates in 50 years and the tightest labor market, it has become very apparent that we need to rethink how we change the employee experience. The next was occupancy and growth challenges. In 2019, this industry saw a dip in occupancy that they had not realized since 2011. A lot of the reasons for this stem around the competition, which is growing in this space, as well as residents that are coming into senior living communities have different expectations and requirements that current facilities cannot meet. That leads me to the next challenge, according to Senior Housing News, and that is the need to provide more costly solutions for middle-income seniors. With the aging baby boomers, North America will be experiencing a significant rise of seniors over the age of 75 years for the next 10 years. These seniors are coming to communities with experience in technology. They're comfortable with their smartphones. They know how to integrate into existing environments when they travel or they go to other households. They also are living a more healthy lifestyle and want to maintain their independence. We need to be able to address those requirements and implement less costly models of care that meet this desired expectation. The next issue is something very near and dear to me personally, and that is embracing and implementing technology. For instance, wearable devices and touch-free technologies allow for fall detection, being able to track location of our senior residents with real-time location services, and seeing how much activity they're getting every day. How about being able to walk into a room and having the temperature and light adjust to your presence without touching a single device? With the Internet of Things, IoT devices allows for this to happen. Next, we have to consider the indoor building environment. As you may know, we are spending approximately 90% of our time indoors. And there are some members of your community, because of limited mobility, who will spend 100% of their time indoors. There's more and more extensive research that shows indoor air pollution is actually more harmful than outdoor air pollution. And so we need to implement indoor air quality measures that can provide safe, clean, fresh air into your buildings. Additionally, technologies that provide thermal comfort. You have multiple people in your facilities with different levels of activity, and our buildings need to respond to provide that thermal comfort. And one of my favorite technologies and most impactful is circadian rhythm lighting. The medical evidence behind circadian rhythm lighting shows the physical and mental health benefits that are realized by implementing these systems. All of this needs to be cloaked in security and privacy. We were going full steam ahead with some of the solutions that we were creating, and then COVID hit. And like the rest of the world, we were plunged into crisis management. Wikipedia describes crisis management the following way: the process by which an organization deals with a disruptive and unexpected event that threatens to harm the organization. 3 elements are common in a crisis: a threat to the organization, the element of surprise, and a short decision time. This is something that we all have been facing the past several months. This crisis is a process of transformation where the old system can no longer be maintained. Therefore, the 4th defining quality is the need for change. As we learned more about the impacts of COVID and the devastation that it was having to our most vulnerable citizens, the team at Delta redirected our research and development efforts on our building automation solutions for your top challenges in 2020 to refocus and look at how building automation could solve the COVID challenges that senior living facilities were facing today. Today, while you are listening to the presenters, I want you to imagine this. What if your building could think? What if your building could react to your occupants? What if your building could take the guesswork out of a safe indoor environment? Now we are going to explore these possibilities. It is now my pleasure to introduce to you Jin Kim. Jin is our solutions architect and an electrical engineer. Jim will spend time outlining how implementing detection processes and streamlining reporting can reduce the introduction of COVID into your facilities as well as other viruses.
No contagion in the memory of living generations has dealt the humanity such a jolt like COVID virus. Its impact is deep and far-reaching and changing the world as we know it. It is a crisis moment. The end horizon of the crisis is yet to come into our sight. Currently, only our desperate hope and a sense of resilience fuel our efforts in sitting out the period of uncertainty. Humanity's collective experiences, distilled in wisdom, remind us that crisis comes with opportunity. A more and flexible use of technology, less polarization, a revived appreciation of outdoors and life's other little pleasures, simply a normal life we used to take for granted. It is this opportunity that I want to focus on and how we can usher that opportunity onto the path to our reality. There are 3 fundamental ways to deal with virus, not just COVID, but any virus. First, prevention. Vaccine is a part of prevention. For COVID, currently unavailable. Second, treatment. According to WHO and Harvard Health, there are no known cures for COVID for the time being. Third, detection. It is the detection that I want to spend some time on. Using the medical knowledge available to all of us and using the technology to integrate processes for detection, we might find a way to turn the opportunity to our desired reality. The whole world is buckling under the weight of pandemic. Many thoughts are bubbling up in our restless and weary minds. Social distancing and lockdown, is that our only option? The burden of economy reset, who will bear the cost? What about bleeding edge technology? Can it help? How about self-empowering ourselves for prevention and detection at a community level? Is that a plausible option? Last, but certainly not the least, wouldn't I, as a vulnerable individual, like to know if I'm infected as early as possible? Let us look at why COVID is such a difficult virus to deal with. It has many different faces. Starting out as an unblemished, normal person, when you get infected, for the first 2 days, you don't show any symptom and you don't spread virus. After that, you start shedding the virus as the infected, but still not showing any symptoms. And when your body starts to react to antigens and antibodies are developed, one of the two things can happen. Either you continue to be asymptomatic and end up being a super or silent spreader, or show symptoms and get treatment and recover. The fact pre-symptomatic and asymptomatic carriers show no symptom, and that they themselves may not even be aware that they are infected, makes COVID such a difficult virus to deal with. There are two most used tests for COVID. First, RT-PCR. It detects and measures RNA. In short, it detects the presence of virus. Second is antibody. It measures antibodies in the system. In other words, it detects the absence of COVID virus. RT-PCR requires a medical expert's involvement, requiring a lab, and it takes time. On the other hand, antibody is as simple as a glucose test for diabetes, and it only takes less than 15 minutes, and it is self-administrable or assisted. This is the expanded view of many different phases of the infected along the time axis. Green curve indicates the counts of RNA since the infection. This is what RT-PCR test detects. An unblemished normal person gets infected. For the first 2 days, there is no symptom, and the infected does not spread the virus. After that, the infected, still not showing any symptoms, starts shedding the virus. This happens within the window period. During this period, only RNA exists in the body, so only RT-PCR test can detect it. Antibody test cannot detect the pre-symptomatic carriers, as it tests only the presence of antibodies in the system. Once the onset of symptoms, the body develops the antibody. Firstly, an antibody called IgM in blue color, followed by another smaller type of antibody called IgG in yellow color. Until the yellow curve peaks, the body is fighting the infection, and after that, the body is recovering. That is, if the patient survives. After the window period, another case can develop. The infected can continue to be without symptoms. Depending on the level of RNA in the body, the infected can become either super spreader or silent spreader. RT-PCR can tell if the infected is super spreader or silent spreader. It tells only if the tested is infected or not. Only when it is combined with antibody testing, the infected can be classified correctly as either super or silent spreader. This does have a huge significance in sealing off the infection source effectively and fast. Based on the patterns of the infected through the infection cycle, a consistent and repeatable process can be instituted to create a COVID-free environment for a community. In the process, under the context of community, both the residents and moving populations, such as workers, can have antibody tests to begin with. They use a mobile app, which I will show you how it could look, to record the results. Among the group of residents and workers, there are super silent spreaders and sick virus carriers, and those that are newly infected, therefore pre-symptomatic. Antibody testing detects super silent spreaders and sick virus carriers, and the mobile app advises those detected to seek doctor's instruction and follow the process. At this stage, the pre-symptomatic carriers are still undetected. This is the process that's repeatable and consistent. Data collection in the service of infection control is not a one-time act. It is a continuous process with real-time tools that bring actionable intelligence to your staff. We want you to know the value of technology in infection control and the insight not otherwise possible. Results 2 to 4, they need to seek doctor's instruction and follow the process. Result 1, pre-symptomatic carriers are still undetected. Since the first testing for a week, a strict social distancing and personal hygiene is observed. Pre-symptomatic carriers by the end of the week will have turned either to be super or silent spreader or sick carriers, all with antibodies in their system. At the same time, there could be newly infected, turning into pre-symptomatic carriers. Right after the antibody test, following mobile app instructions, all with antibodies in their system, meaning super silent and sick carriers, are advised to see the doctors and follow the process. Those who have turned pre-symptomatic by this time, the antibody shows no result, but they will be required to answer the survey questions on the mobile app. The answer must be given accurately and truthfully. The app raises an alert to the infected individual that there might be pre-symptomatic carriers and asking to seek doctor's confirmation, mostly using RT-PCR. This is how, at a community level, the environment can remain free from the source of people-to-people infection, that is, absence of super silent and sick carriers and pre-symptomatic carriers. Stigmatization is neither part of the process nor its consequence. Any infected individual will be given the alert they need at the earliest possible moment. In fact, they are the greatest beneficiaries of this process. Other routes of infection, such as material to human, can be addressed using technology effectively. My colleague, Dr. Dorota, will talk about it in detail. This is how the test, the survey, and the alert could look on mobile app. From a central location, with real-time feedback from every mobile app users, the administrator is in a position of central control and monitoring for workflow management and planning. If one community can create a COVID-free environment, it can be replicated to other communities. After all, a city is a collection of communities. So is the nation and the whole world. Every community can be self-empowered to create a COVID-free environment for themselves.
Thank you, Jin. Now, I would like to turn the presentation over to Dr. Dorota Balkowska-Bawasko, our resident PhD and Product Solutions Manager. Dorota will show you how technologies that integrate into your existing infrastructure can prevent and eliminate the spread of viruses in your facilities.
Nowadays, our landscape is changing. Indoor environment quality, air quality in particular, becomes the highest priority in built environment. And like never before, we are realizing the absolute need for prevention methods, which can substantially limit our exposure to viruses and bacteria. We also need to realize that we spend on average 80 to 90% of our time indoors. And in senior living and assisted living facilities, older adults often spend all of their time indoors. Hence, the importance of providing safe and healthy environment for them, for working staff and family visitors. What is building automation? We recognize it as a solution which can enable creation of healthy and comfortable indoor environment. How it happens is pretty simple. Detection of indoor conditions and control of different systems are integrated under one building automation platform. We are able to know what is happening indoors and in the overall space and react to unwanted changes in indoor conditions. These days, we can additionally reinforce standard operations by utilizing technology against disease transmission. We can introduce to the system air cleaning methods by ionizing and filtration, provide touchless controls, and use disinfection with ultraviolet light. As we described it, building automation main goal, besides energy savings, is to create a healthy and comfortable indoor environment in every space in the building where people spend their time. And quality of this created environment has a significant influence on well-being and satisfaction of occupants and employees. As we cannot be cleaning every minute of the day, let us recognize where technology can be used in conjunction with building automation to provide an effective prevention strategy. Air ionization is not a new technology. It is known for a few decades and has been used in, for example, food industry to control pathogens. This technology of purifying the air turned out to be very effective during outbreaks of SARS and different strains of influenza. Ionization modules can be installed in existing or new air treatment systems, and they function as a simple and pretty affordable addition, which does not involve increasing system pressure, adding fans, upsizing filters, or making large changes to air handlers or ductwork. In most cases, ionizing modules can be attached on the entering side of a cooling coil, in terminal units, which directly supply the air to the rooms, or simply in the rooms themselves. They are practically maintenance-free and are typically designed to last the lifetime of the associated air handling system. Air ionization process itself is based on conversion of atoms and molecules into positively and negatively charged ions. Negative ions, called anions, then stick to droplets and solid particles in the air in an effect similar to static electricity. Anions can deactivate harmful substances like dust, pollen, fungal spores, microbes, odors, volatile organic compounds, and airborne bacteria and viruses. Overall, this is an active process which involves sending ionized particles into space and providing continuous 24/7 disinfection. Furthermore, ionizing modules are not emitting dangerous byproducts. HEPA filter stands for High Efficiency Particulate Matter Filter. They were commercialized in the 50s and they've been used in applications that require contamination control, such as in pharma and health industry. The HEPA filters are composed of a mat of randomly arranged fiberglass with diameters between 0.5 to 2 micrometers. They are designed to clean the air from particulate matter, having the lowest efficiency still at the level of 99.97% for the most difficult to be trapped particles of about 0.3 micrometer size. In the range of coronavirus size, which on average equals to 0.12, 0.13 micrometers, HEPA efficiency is close to 100%. Different sized particles are trapped by HEPA filters with the use of three filtration mechanisms. Heavy particles are trapped by inertial impaction by hitting the fibers, whereas the mid-range particles are collected by interception when they touch the curved contours of the fiber. And the smallest particles move randomly and collide on the fiber. The smaller the particle, the higher its freedom of movement, and therefore the higher the probability of encountering the fiber and being trapped by this diffusion mechanism. One of the technology achievements is the possibility of touchless controls of the indoor environment. Very effective sensor fusions, which can detect various environmental factors, work as an integrated hubs to provide knowledge about surroundings in many aspects. Sensor fusions are combining sensory data in a way that it results in significantly better observation capabilities. And to get the best view of indoor space, such sensor hubs can be installed on the ceiling. There are few aspects of this subject matter that in particular are pertinent. Occupancy, movement, and density detection describe the state of the space in terms of occupant presence and then seamlessly can control lights, sun blinds, heating, ventilation, and air conditioning system according to scenarios and sequences built in automation system. Sensors which detect harmful gases and particles will target ventilation to provide healthier indoor air. Temperature and humidity can be measured to provide optimal thermal conditions. And due to the fact that viruses are best preserved in low humidities, keeping it in the range from 40% to 60% is essential. Another factor, lighting intensity and color detection, can support human-centric lighting and circadian rhythm aspect to it. Safety, on the other hand, can be provided with, for example, access control, detection of window opening, and isolation countdown for the rooms. As Peter Drucker, one of the finest management consultants, once said, if you can't measure it, you can't improve it. Therefore, building automation system uses data provided by sensor fusions to improve indoor environment quality and increase the overall occupants' and employees' satisfaction. The use of mobile devices is nowadays very common, not only for contacting people, but also in other areas. For example, in health industry, the practice of medicine and public health is supported by mobile devices. Personal smartphones became also means for adjusting indoor conditions where the entire environment can be controlled with the use of one app on a phone, which then decreases or even eliminates the use of communal devices. Activity-based controls additionally enable setting multiple conditions in the room at once due to the fact that adjustment is done by various systems which are integrated under building automation on the technology level. Furthermore, touchless voice control can help seniors and challenged people to discover their ability to adjust conditions in their rooms, how they want to and when they want to. Both methods of control, with sensor hubs and mobile devices, decrease or even eliminates the need of using communal devices, which are seen as the points of contact and disease transmission. Another prevention method uses ultraviolet disinfection technology, which has been known for over 2 decades in air and water treatment without the use of harmful chemicals. Ultraviolet light is a type of electromagnetic radiation which has shorter wavelength than visible light. Organisms which are exposed to UV light range from 0.2 to 0.3 micrometers have their DNA and RNA damaged, leading to rupture of cell walls and death of these organisms. Disinfection is activated at the exposure of only 1 to 2 seconds. And so, this short wavelength light, which we're going to call UVC, is seen as the most effective radiation capable of killing viruses and bacteria. UVC lamps can be installed in air treatment units and work without interruptions there, or in spaces with periodical usage, for example in bathrooms, where this type of disinfection can be triggered by unoccupied state of the room. Summarizing, it is a method for disinfecting air and space which otherwise could function as a disease transmission platform. This pandemic raises our awareness on how important improving indoor air quality is and how the adoption of technology can help us to fight with virus spread. There are 3 aspects to the prevention strategy which need to be considered. Firstly, gaining the knowledge about the indoor environment from the sensors. Secondly, using activity-based controls to make systems operation adequate to real requirements. And last but not least, embracing existing technology, like ionizing, high-efficiency filtering, UVC lighting, and touchless controls, and integrating it to the building automation system, creating solutions which can mitigate the risk of disease spread. All addressed prevention methods give us hope during these tough times, as they help to create a safer and healthier indoor environment for all of us.
Thank you, Dorota. What I would like to emphasize after listening to the presentations that you just heard is that a pre-COVID system is one that can no longer be maintained, and that changing to a new system should not be disruptive, cost prohibitive, or complicated. We understand the financial impact that you are dealing with today as a result of this pandemic. Some studies show that maintaining high-quality care in senior living communities has increased up to 73% for communities that remain COVID-19 free, and up to 103% for communities that have tested positive for COVID-19. Other studies have tracked additional costs associated with COVID, such as PPE and increased cleaning, and the estimates are $8 to $11 per day per resident. So when we factor in the costs that have increased and that you're dealing with because of this pandemic, we understand that any investment that you make needs to deliver a return. a return in the form of time savings for your healthcare staff. Cost savings are realized when buildings are operating more efficiently because energy consumption is reduced. And by enhancing your resident and healthcare staff experience with improved indoor air quality, the results are happier and healthier residents, more productive employees, and you are going to get the advantage to attract new residents and families into your communities. And talking to owners and operators over the past year, the two most common concerns that I have heard is that building automation is too expensive and it is too complex to manage and maintain. Our next presenter, Jamie Feardon, a building automation specialist, is going to walk you through the steps and what you can experience and how to budget and prepare for the integration of building automation into your facility.
Hello, my name is Jamie Feardon. I'm the Business Development Manager for Delta Controls, responsible for our Canadian channel. I spent my entire career in sales and have been in the building automation industry since 2002. I started in the construction industry working for a building automation contractor and then transitioned to the manufacturer in 2012. Throughout this time, I've been involved in many healthcare projects, including some of the largest P3 hospitals in Canada. We understand that every building in your portfolio comes with a unique set of challenges. Some of your buildings are probably older, in need of a retrofit, have old hardwired thermostats or no thermostats at all. Temperature needs to be set manually. These buildings use centralized hot water or forced air systems that give you very little control. You don't have the ability to remotely access the site, and so you need to dispatch someone if you have a problem. This also creates a problem with respect to COVID and some of the new government regulations that limit the number of sites a worker is able to go to. Some of your buildings may have an existing building automation system in them already. In those, you could implement new control strategies that improve patient comfort, safety, and energy consumption. And then you may have some buildings that are in the design or new construction phase. So let's look at how we can move forward with each one of these scenarios. For facilities without building automation systems, you may want to consider installing a building automation system that is scalable, one that allows you to start to take control of the main mechanical and electrical systems so that you can have eyes on what the building is doing and then expand to perhaps some zone control or lighting control as your budgets permit. You should choose a platform that is open protocol so you have the maximum amount of flexibility in the future. You'll want to work with an IoT-friendly platform where both your building operators and your IoT people can work harmoniously together and support each other. Choose a system that has the capabilities to not only manage your HVAC systems, but also your energy management, lighting control, and security on the same common platform. Find the balance between energy management strategies and comfort. Future-proof your building with a system that uses the most common HVAC and IoT protocols. This allows you flexibility as the needs of your building and of your residences change. If you don't have the budget to install a full building automation system, you can install some IoT sensors that allow you to get basics like temperature, occupancy, sound, and light levels. If your facilities already have an existing building automation system, you can consider installing the software on a localized server or in the cloud so that you can connect all of your sites at the same time and access them remotely. If the system you have doesn't allow that, you can install an enterprise-level system that will pull all the data from the existing building automation system and also serve as your main interface to all your sites. Each building specialist can have customizable dashboards that allow them to remotely access their facilities so that they can monitor and troubleshoot the facilities without having to physically go into them. This can be a significant cost savings to having to have a single building specialist per site. You can integrate new technologies into existing senior living facilities with sustainable features like HEPA and UV filtration. New programmable lighting technologies and advanced fault detection diagnostics should be considered when renovating or upgrading existing facilities. You could provide residents with an app to control the lighting and temperature in their own space without having to get out of bed to do it. New building controllers, sensors, and meters can be added to support all building types, large and small. Sensors that send real-time data, such as occupancy and noise levels, can provide valuable information for improving space utilization. These can be networked through common open protocols such as BACnet, Node-RED, and MQTT, and served up remotely to users with appropriate credentials. When it comes to new construction, owners, developers, and operators must start planning now for what senior living will look like in 2040 and beyond. Changing needs, expectations, and wants will demand innovative responses. When building a new extended care facility, my recommendation to building owners and operators is to stay involved and engaged throughout the entire process. Too often, the owner's vision is lost during the construction phase, and contractors make decisions without knowing what that vision was. Make sure that your design intent gets communicated all the way through the building process. Don't accept shortcuts and allow your vision to be value engineered out. The integration of technology into senior living communities can help residents maintain their independence, be socially connected, and exert choice and control over their environment. Building technologies can be leveraged to reduce a building's mechanical, electrical, and plumbing systems operational costs, as well as improve the building specialist's response time. Other technologies use sensors in residents' apartments to monitor resident activity and safety. Monitors can detect if a certain resident's activity level has changed, or the resident falls or fails to get out of bed. These technologies can be monitored by nurses, increasing their efficiency and reducing operating costs, which will ultimately improve the occupant's comfort.
Thank you, Jamie, for your detailed approach and recommendations. As we wrap up, I wanted to share this quote with you that I came across a couple of days ago, and I literally had an aha moment. The role of genius is not to complicate the simple, but to simplify the complicated. If you take nothing else away from our time together, know that this quote perfectly summarizes the roles and responsibilities of technologists, innovators, engineers, and integrators. Yes, building automation systems are incredibly sophisticated and complex, with state-of-the-art technologies like artificial intelligence, human-machine learning. You'll hear phrases like algorithms and analytics, but the end result and functionality of your building should be as intuitive and easy to use as an app on your smartphone. We know how important it is ensuring safety and care of our aging population, and we want to arm you with the tools to be your own expert in creating a safe and healthy environment for all. This pre-recorded video webinar has just ended. Please join us now at the Delta Controls exhibit booth. Today's presenters are available to answer any questions you may have. We look forward to seeing you there. Thank you.